Welcome, everybody. Thanks for taking time out of your busy schedules to conduct the business of the union. It's a humbling experience to be in the presence of those who continue to do good work our founders set out to accomplish when nearly 90 years ago, in amidst the Great Depression, they gathered in a Chicago hotel ballroom and chartered this association. If this past year has reminded us of anything, it is that all aspects of our industry are a team sport. We are simply stronger together, as Joe has stated, and our actions of this past year demonstrate that. My personal congratulations to Amerijet International and Western Global Pilots. As a reminder, no pilot operates completely alone, and our union will literally go anywhere in the world to aid our colleagues in need. Welcome to the team. In today's global environment, especially with regard to the current pandemic, international issues have a dramatic influence on the entire aviation industry. If we sit back and only react to the threats our international pilot community is confronting, we cannot expect to survive in an increasingly global marketplace. As ALPA members, we must be proactive. We must be fully informed. We must be in the room. Only then will we be in the position to assess how these issues will affect us and what strategies we must establish to advocate for or against these policies before they're implemented. With that in mind, and over the next few minutes, I would like to share with you how your union is working on the international front that directly impacts our profession. As you are undoubtedly aware, our organization is a key member of the International Federation of Airline Pilots Associations, ALPA, which is based in Montreal and right across the street from the International Civil Aviation Organization, ICAO. ICAO develops the standards and recommended practices for the global aviation industry. And through IFALPA, we get a seat at the ICAO table. At last count, IFALPA represented more than 100,000 pilots in nearly 100 countries. As a member of IFALPA, ALPA is the only pilot union that has 2 seats at the IFALPA table. Captain Joe DePete, representing the United States, and Captain Tim Perry, representing Canada. By working together with the other 98 global pilot unions on issues important to our profession, where safety, security, or industrial related, we are confronting global challenges collaboratively with one unified voice. While the global pandemic has impacted how ICAO and IFALPA conduct business, the work continues, and policy is being developed that will have a significant impact on this profession. A prime example of this is the ICAO Cooperative Oversight for Cross-Border Operations Subgroup. This newly formed group, which I have been part of representing IFALPA for the last year, has been tasked in addressing the rapid evolution of new business models and cross-border group operations, which industry has highlighted that policy change is needed to correct certain inefficiencies that they seem to be affecting the global aviation system. The European Aviation Safety Agency, EASA, and the other European participants are keenly interested in the cross-border group operations that would streamline operations across several air operator certificate holders based in different countries but belonging to a single parent company. At the same time, civil aviation authorities in South America are pressing for flexibility in short-term aircraft interchange operations, which would allow different operators based in different countries to use the same aircraft for their respective flights. Think about it like this. Operator 1 flies the 767 from Santiago de Chile to Buenos Aires using Chilean pilots. Then Operator 2 flies from Buenos Aires to Miami with Argentinian pilots. And then, using the same aircraft, Operator number 3 flies from Miami to Lima using Peruvian pilots. You can imagine how confounding this is. Who is regulating the aircraft? How are the crews being trained? What flight time, duty time rules are in place? And how is maintenance in compliance? Who's overseeing that? Who is responsible if there's an accident? These are the questions we are raising at the ICAO table. And let's just state the obvious. This is just the latest scheme to skirt around the social protections in different countries and to ignore scientific data that has made our industry the safest mode of transportation in the world. Recently, 2 additional ALPA pilot experts have joined me, Karine Gelly from France and Pablo Albarcin from Argentina. And I very much look forward to seeing their contributions to this important topic. Another area where we are engaging is on the recently formulated ICAO pilot training and licensing panel. After the 737 MAX accidents, we were heavily involved, corresponding directly with the ICAO Secretary General, stating it is time to look at the global standards and recommended practices concerning pilot training and licensing. The pilot training and licensing panel has been tasked with just that and is broken down into 4 subgroups: automation, think single pilot operations; competency-based training and licensing; distance learning and others; flight simulation and training devices, non-motion sims; and women and minorities. I am proud to report United's Captain Rob Thomas was selected by the ALPA president to chair the ALPA Pilot Profession Working Group, which is tasked to support the ALPA Pilot Training and Licensing Panel member, Captain Hugh Harder from Germany. Working alongside Rob in advisor roles are Paul Ryder, Abigail Passmore, Jeff Griffin, and ALPA's President Committee for Diversity and Inclusion Chair, Camila Torreta. We are all aware that in North America, we have embraced major safety benefits, and as a result, they have led to improved training and experience standards. However, there are other countries who allow airlines to take any and every advantage to cut cost at the price of safety. Much like I had described earlier concerning the cross-border initiative, the ICAO developed multi-crew pilot license, or MPL, is another major example on the race to the bottom. For those not familiar, to earn an MPL, and I use the term earn rather loosely, requires only a bare minimum flight time of around 40 hours and a total of 240 hours logged, most of which can be conducted in a simulator. It's basically a learner's permit, and it puts the individual in the right seat of a 737. The data proves that this places a heavy burden on the airline captain to overcome any training and experience shortcomings without the safety net of another highly experienced flight crew member. Although Canada currently accommodates MPL training in their regulations, none of the air carriers are putting 240-hour MPL pilots in the right seat. It's quite clear that ICAO needs to increase the minimum level of training and experience requirements. The ALPA members of the ICAO Training and Licensing Panel are providing our professional expertise and making recommendations that reflect the latest best practices in our industry, from improvements in training tools and technologies, and pointing to our strong safety programs. I expect we will see much more on this topic in the year ahead, as this panel develops policy that will directly affect the working reality of every pilot flying today and in the future. The dark shadow cast by coronavirus, COVID-19 pandemic over the past years affected us all. While I would like to state that this rough flight has nearly reached its destination, we all know better. There is still too much uncertainty. However, through the storm, we have endured. And I'm happy to report the work of the Air Safety Organization continues without missing a beat. And our multi-layered approach to the pandemic has resonated throughout the halls of the government and industry. As Joe stated, and I'd like to repeat, a key strategy to ensuring the safety of our passengers and crews has been mask mandates. Early in the pandemic, ALPA saw that no one was requiring mask wear. And so we began to collect and share reports with industry and government. Based on this data, airlines did follow institute policies requiring face masks, but without a mandate from the government, enforcement was impossible. In the United States, the new administration and the President's executive order, ALPA supported the CDC order to require all persons on board any form of public transportation, including airlines, to wear masks when boarding, disembarking, and for the duration of travel. Quickly, as Joe reported, other mandates followed. The TSA issued security directives which required individuals to wear a mask at TSA airport screening checkpoints and throughout the commercial and public transportation systems, including airports, which has recently been extended to September 13th. The FAA updated SAFO guidance to include CDC's information on face masks, in addition to providing updated information on health monitoring, protections, and response. Unfortunately, with these new mask wear requirements, we have begun to see an increase in documented incidents of unruly passenger behavior. We are in full support of the FAA's zero-tolerance policy against such behavior, and it is nice to see the FAA taking action. Recently, a passenger received 30 months of incarceration. Throughout this pandemic, and as essential workers, we have continued to keep supply lines open and the world's economy moving. And we actively advocated for airline pilots who desired to be vaccinated be amongst those in priority status. A key consideration, however, was the wait time after which vaccine dose before a pilot could go to work. As you may know, given the experimental nature of the vaccines, the FAA's baseline waiting policy is 1 year. Obviously, this requirement was not sustainable, and the association worked diligently to get the FAA and Transport Canada to approve pilots to be vaccinated. In the United States, the Food and Drug Administration and the FAA approved 3 vaccines, Pfizer, Moderna, and Johnson & Johnson, with only 48 hours duty restriction, assuming the vaccinated flight crew member experiences no adverse side effects. And while distribution prioritization is determined on a state-by-state basis, we are beginning to see quite a few of our members obtain the vaccine. In Canada, Transport Canada has stated that receiving a vaccination will not cause any restriction to pilots, as Health Canada approved the same 3 plus AstraZeneca vaccine. Unfortunately, Canadian pilots have not seen the same access to the vaccinations as the US pilots, and ALPA continues to advocate for it on their behalf, especially since there are many of our places in Canada where pilots provide the only link to the rest of the world. Between the US and Canada, nearly 35 million cases of COVID have been confirmed, and many directly affected have been our members and their families. Aside from life-threatening symptoms and the persistent worry of potentially spreading the disease to colleagues, friends, and loved ones, there is fear of long-term effects on the pilot's professional career. Thanks to the efforts of the association, we have been instrumental in advocating for sound policy for pilots who endure COVID-19. It sets very reasonable evaluation criteria for aviation medical examiners to follow. As many may be unfamiliar with the specifics, I strongly encourage COVID-19 affected pilots to make a copy of the FAA letter dated March 26, 2021, available on the FAA website, and bring it with them to their next medical certificate exam. However, bear in mind that if a pilot was placed in an intensive care unit due to COVID-19 or suffers residual symptoms, the AME may defer the exam to higher authorities for additional testing or documentation. It is likely that the face mask use, social distancing, and frequent washing of hands may be with us for some time, and it's good to see some loosening of the travel guidelines for fully vaccinated travelers. While many international destinations may still require testing after arrival or before departures, this is clearly an improvement and directly related to the availability of vaccinations. I know that this last few months have been trying for us all. Everyone has been touched by the unfortunate events of the pandemic, experienced some degree of loss, and felt some moments of hopelessness. But as I stated earlier, you nor any of our members are ever truly alone. With that in mind, with my few remaining minutes, I'd like to share a profound story from the front lines that was showcased at the recent Global Pilot Symposium in mid-March. Please turn your attention to the screens.
When the hotel phone rings in our room, especially during rest, we expect it to be crew scheduling or maybe even hotel staff. But our next story takes a dramatically different turn for a Kalitta Air pilot while sleeping in Hong Kong. He is informed that due to a positive COVID test, he will be picked up and transported by ambulance to a hospital in 30 minutes. Our next story is an example of caring for another pilot like you would care for a family member.
In approximately July of 2020, we've had issues with Hong Kong with pilots testing positive and unfortunately being taken away to the penny place where crews were being held until they either obtained a negative test or you had to have the antibodies in your system before being released.
All of this started after, obviously, in February when COVID really started affecting the airline. We had no official positive cases with our pilots. In the end of November, we started stacking up a number of cases. This all came to a head right at the end of November and beginning of December when we started getting guys testing positive and then were placed in the AWE, that's the Asia World Expo, and what they consider a field hospital. We had to go into action because guys got very desperate and the company was just not coming forward and helping out and bringing care packages and so forth. So we scrambled with quite a few of our members, general committee members, and put it all together. We weren't given access from the government, from the health department, and then from the Asia World Expo, which was basically on lockdown. We just made the gamble and ended up getting these care packages to our pilots, almost walking them all the way into the facility of where we had to stop, and then everything else from there went on with nurses and so forth. And we just ended up making our way in there, and that's what unions do. They take care of their people in times of trouble. We had a few that had tested positive and were at the local public hospitals. But that was when Hong Kong was in a transition of moving people from the hospitals to the AWE. The AWE then became a massive field hospital, being able to house hundreds of people in individual beds, all set up in a place where you could go watch Guns N' Roses in a normal time. But the lights were always on, the conditions were terrible. And so that's when it really started affecting the pilots. And so we were able to get in and help some other foreign carriers, in addition to the pilots that we had in the Asia World Expo also.
I began my rotation in November on the 1st. And on the 5th of November, I ended up in Hong Kong, which is typical from an Anchorage to Hong Kong segment. Spent roughly a day and a half in Hong Kong, went through the protocol testing at the airport, obviously tested negative because I did not receive a call from the Hong Kong Health Department. And then I was on my way again to back through a typical rotation, which may carry us back to Anchorage again. I left Anchorage on the night of the 9th. Landed in Hong Kong on the 10th of November. Again, went through the same testing protocol. At about 6 a.m. in the morning, I got a phone call on the 11th from the Hong Kong Health Department that said that I had tested positive for COVID and to remain in my room, and that an ambulance would be there in 30 minutes to pick me up. So within the first 30 minutes of receiving the phone call from the Hong Kong Health Department, the first call I made was to our scheduling department to let them know that I would be unavailable for the flight. And I asked them to make contact with the remaining crew members. Secondly, I called my wife, who was in complete shock at what was going on. And we discussed the uncertainties of what may happen or where I would be going. And then behind the scenes, our company was contacting Jeremy and the MEC And so at that point, that was about the most contact that I had with anyone, because I was quickly out the door in a wheelchair, down to an ambulance and to a hospital where I knew nothing.
So Robert unfortunately was going to a government hospital, which put us all into shock because we didn't understand what conditions he was going to be going to. I had already started working with Jeff Sterling and his SERPS team. And Jeff, I believe, reached out to Colin and started giving support right away to Robert.
Initially, we were trying to handle all this by ourselves, so I was getting contact from the MEC and told to contact these guys. I'd have my team contact them. And at the beginning, it was really fact finding. I mean, we didn't know what we were getting into yet. This was new to SERP. This was new to us as a company. We really hadn't dealt with detained crews before. And we were finding out, bits and pieces as far as they needed bedding, they needed food. They needed better electronics ability to contact family and company and so forth. Well, in the process, we had one crew detained and they got released after about 9 days. By the time the next one came along, I reached out to ALPA National, and John McFadden, the National CRP chair, got me in touch with Colin. He made some calls, got me in touch with Colin, and he was able to help us with the subsequent crews. By the time Robert was detained, probably worked out better for his case. We had it down pretty much to a science at that point. As I told Robert, download WhatsApp, and I got him on there, and I paired him into a conversation with Colin and said, Robert, this is Colin. Colin, this is Robert. Told Robert who Colin was and what he's been doing for us. And basically, once I saw they were talking to each other and that had started, I could actually step back. And it was an enormous relief for us. Not only was he helping exponentially handling our pilots, but it was done in much less time than was taken before.
So after helping out the first two guys in Penny's Bay and Jeff, it became a pretty simple process of, okay, figuring out what the guys need as a pilot. So when I'm thinking, okay, if I'm stuck in quarantine camp, what do I want? You know what I want? I want my own food. I want a nice towel, some just some necessities that we're accustomed to when we're on the road.
So that first day was a real whirlwind. A lot of despair, a lot of angst, anxiety. So the first day and a half, 2 days were very difficult. And then the third day, which was November the 13th, is when Colin and I made contact with each other. And so when Colin became engaged in my situation, it just immediately turned the desperation, despair, and anxiousness into a more manageable situation every day. Finally, on day 22, the positive antibody test came through, and I was out of the hospital. But all during that time, both Jeremy and Jeff from our MEC and also Colin just stayed in constant contact.
Hong Kong ALPA really with us involved, really started overseeing this, and it was immediately passed over to Colin because, as Colin said in the beginning, the proximity of it, and then Colin just grabbed the bull by the horns and ran with it.
Robert was a little different. Robert, you get the antibody test, you test negative, and then you get to go home, get on a jail free card. Well, unfortunately, he wasn't testing negative, and his antibodies weren't increasing in a timely fashion. So at that point, it was time to ratchet it up a little more. I had started calling National, and those guys were absolutely instrumental in helping to get us a little more political power to send a solicitor over there to help Robert out.
The conduit is ALPA between the United States and Hong Kong. That's the connection. And then it reaches all of us, then get in contact with Colin, and then Colin runs with it. And the rest of the story is kind of history there.
Obviously, ALPA being the overarching umbrella, connecting all the unions together is the benefit for that is immense, just being able to get to people on the ground. So having ALPA as an umbrella to connect all the people then allows the human or the interpersonal connections to happen.
For international pilots like most of us here, if you were ever to have an incident anywhere in the world, other countries, Japan, I mean, Indonesia, the Philippines, and you taxi off a runway or something like that, and you look for somebody to protect you, the local authorities are not going to protect you, but it's the ALPA connection in one of those countries that's going to protect you. At the end of the day, we're all pilots. It's a pretty small community, and we're all going to look after each other, but it's the connection of ALPA that really puts it all together. And once again, this is what unions do. Your unions protect you, and you'd like to think when you're in a foreign country that another union is going to look after you. And that's how it's done through ALPA.
Not only pilots helping pilots in the union helping pilots, but it's also the pilots in the union helping the family. I can't tell you how important it was to my family, my wife, my mother and father, to get those phone calls from Jeremy and from Jeff and from Colin, and letting them know that, hey, everything's going to be okay. We've got a network around him right now. And so it's, there's that added benefit of bringing the family into the equation as well in the chirp situation.
The support that we received from ALPA, from National, from ALPA, from other carriers was absolutely fantastic. Like Robert had said, we went all the way out to the families. We stretched everything. It doesn't matter if you're a huge carrier or you've got 12 people in your unit. ALPA looks at everybody the same, which was fantastic. In this particular situation, the MEC and the company work hand in hand, along with National and ALPA, all collaborating together as one team to reach a common goal to get Robert out.
We got a lot of course, just by any union, any company, you got a lot of well-meaning, well-wishing folks out there who want to do a good job and help their fellow pilots. But what made the big difference in this case is that networking, because you can be sitting in a hotel in LA with the sincerest of intent of wanting to help people, but if you can't connect the dots to get what you need to talk to the people you need to talk to and to get the supplies you need to get to the people who need it. So that was the biggest difference between the beginning of this pandemic and the end.
22 days in a government hospital in Hong Kong. It's stories like Robert's that fuel the more than 425 safety volunteers in the Air Safety Organization to continue the work we do on behalf of more than the 59,000 pilots in the United States and Canada. And that is just one story. In addition to the real-life examples of our global pilot family, I also had the privilege of being part of the GPS panel discussion with fellow international pilot leaders. It presented the perfect opportunity to address several topics, such as the global response by pilots to the challenges presented by the pandemic, the restructuring of the industry, and working toward a more financially, socially, and environmentally sustainable industry. But most importantly, I was able to highlight how collaboration and pilot unity have helped advance our profession. The partnerships cultivated through the 737 MAX grounding and COVID-19 have demonstrated how important labor is to developing solutions and moving forward. We found that airline managements that don't bring labor into the discussions early on are being left behind, because the data proves that by working collaboratively, we can achieve great results. As we've learned from the past 14 months, there's no checklist for handling the issues brought about by the global pandemic. But we do know that the decisions we make today will impact our industry for years to come. For nearly 90 years, we have stood our ground, worked on the side of right, and have continued to be the conscience of the industry. And while the story of the pandemic is still being written, I am proud to have each and every one of you on the team. Thank you for your time, and please continue to fly safe.